For this PSA video, I chose the topic of cervical cancer. Cervical cancer occurs when there is a gene mutation within the cells that comprise the cervix, which is the lower part of the uterus. The American Cancer Society estimates that in 2019, approximately 13,170 new cases of invasive cervical cancer will be diagnosed in the United States, and approximately 4,250 women will die from this disease. Although these statistics are relatively low compared to other cancers, in contrast, they are remarkably high for a preventable cancer. Cervical cancer, if caught early, is a very treatable disease that patients can recover fully from while maintaining a good quality of life. What causes cervical cancer? Almost all cervical cancer is caused by the human papillomavirus, or HPV, but some other risk factors include smoking, having HIV or other immunocompromising diseases, prolonged use of birth control pills greater than 5 years, having given birth to 3 or more children, and having multiple sexual partners. According to the CDC, there are 13 types of HPV that are known to cause cervical cancer. HPV is extremely common, with 1 in 5 women contracting this disease at some point in their lifetime. Although the prevalence is so high, the immune system normally eliminates the disease in a few short years, but for some women, the type of HPV that was contracted may lead to cervical cancer. How will you know if you have cervical cancer? Cervical cancer may or may not cause symptoms, which is why prevention and screening is so crucial. Some signs and symptoms of cervical cancer may include postcoital bleeding, which is bleeding after intercourse, abnormal bleeding between periods, and discharge that is abnormal and sometimes foul-smelling. It is a good rule of thumb to see your women's health provider if you are having any acute vaginal symptoms. What can you do to prevent cervical cancer? Primary prevention is the gold standard with any diagnosis, and cervical cancer is no exception. The best prevention for cervical cancer that can be offered to patients is the HPV vaccine. The FDA currently endorses 3 vaccines that protect against HPV. Of these 3 vaccines, there is only one that is available in the U.S., which is Gardasil 9. Gardasil 9 protects against HPV types 6, 11, 16, 18, 31, 33, 45, 52, and 58. Secondary prevention. According to the American College of Obstetricians and Gynecologists, women aged 21 to 29 should have a Pap screening alone every 3 years. HPV testing is not recommended in this age group. Women aged 30 to 65 should have a Pap screening as well as HPV testing every 5 years. Generally, if a Pap comes back abnormal, the sample will undergo HPV testing and reflux. At this point, the provider will decide if the patient is a candidate for a colposcopy based on age as well as risk. What if I have an abnormal Pap? When screening for cervical cancer is completed routinely by ACOG guidelines, cervical cell changes can be found early and treated. According to ACOG, it usually takes 3 to 7 years for high-grade changes in cervical cells to become cancer. Cervical cancer screening may detect these changes before they become cancer. Women with low-grade changes can be tested more frequently to see if their cells go back to normal. Women with high-grade changes can get treatment and have these cells removed. A colposcopy is a method used by women's health providers and patients who have abnormal squamous cells detected from their Pap. A colposcopy allows the provider to take a biopsy of cervical tissue for further testing. During the colposcopy, tissue may be obtained by either a punch biopsy or endocervical curettage. If these methods are worrisome to the healthcare provider, then an electrical wire loop or a cone biopsy may be used instead. Treatment of cervical cancer. Treatment of cervical cancer depends on staging, which is 1 through 4, other health conditions, and personal preferences, with options including surgery, chemotherapy, and radiation. When abnormal cells are detected early, treatment is much easier, and patients will have better outcomes. Patients who seek advice and treatment early generally have the same quality of life that they had prior to their diagnosis of cervical cancer. Early detection of abnormal cells may prevent the development of cervical cancer altogether.